Else. All right, thanks very much, Allie. National Drug Take-Back Day is this Saturday, and it's meant to remind us why it's so important to give back our unused medications and prescription drugs. Luckily, Scripps Health has a way to make this a whole lot easier. Physician Chair of Scripps Opioid Stewardship Program, Dr. Ole Snyder, is here to tell us a little bit about that. Welcome. Nice to have you here.
Oh, thanks for having me, Carlos.
All right, so let's get this out of the way really quickly. We don't flush our unused pills and medications down the toilet.
That's right. That's not best, Carlos. You know, despite what people have been proposing over the years, we don't want people going through the trash and looking for those medications or having them leak into our groundwater. And if you flush those medications down the toilet, our wastewater facilities aren't that perfect at getting them out. And a little vignette in Seattle, they discovered by taking mussels out of Puget Sound that those mussels had oxycodone and antidepressants in them.
Wow.
So unless those mussels have some really bad doctors, we're getting our medications into nature.
Yeah, so the alternative is to be responsible with your medication, especially if you're not taking them anymore. So many people have cabinets full of stuff, and it's just sitting there. What should they do?
Well, that's right, Carlos. It's a big problem. Those medications, if they go unused, they're a temptation to family members, to visitors in the home, and they become a target to folks who are looking to sell those on the street and make the lives of those suffering with opioid use disorder addiction worse. Our teens are experimenting with them. They're exploring and risk-taking, and 62% of teenagers have a gateway into heroin and illicit medications when they get there by going to the home medicine chest.
So how do we dispose of these?
Well, the National Drug Take-Back Day is a great thing for awareness, but it's one day of the year, and it's not convenient. If you go out and have surgery the day after it, or go to your dentist the day after it, it's rather inconvenient to find a law enforcement office and dispose of it correctly. So Scripps has invested in our community and our patients and made it convenient, and we have drug kiosks now at 3 convenient pharmacies where our patients are already getting their health care. And they're able to bring those in, dispose of them in an environmentally friendly way where they're incinerated and protected and it's safe. And we've opened that up to the public because we want to protect our communities as well.
All right, so we're going to put the locations of those drop-off points on our website, KUSI.com, so people can participate in getting rid of the drugs. But let me ask you a question. I'm curious what happens to the efficacy of the drug or the potency of the drug after it's been sitting in your cabinet, say, for 5 or 10 years, because some people don't even look at them. They just leave them there.
Well,
are they dangerous?
Well, they still have effect. Mm-hmm. You know, they might be expired, but they still have effect. And every drug is different, and they're still a target, and they're still fueling the addiction crisis and the opioid crisis in the country. So they still matter.
I had a neighbor steal some pain medication after my knee surgery right out of my bathroom.
Of course.
And I didn't know about it until I realized that I had no pain medication left, and I knew how much I had taken. What do you do in that situation? Should you report that? Should that be something that you talk to your neighbor about? Because this is something that's such a problem. What can that do medically to somebody to take somebody else's medication?
Well, you know, medically it's a risk, and it's technically a crime. It should be reported. If you think about it, these have higher street value than you realize. Those medications can be worth hundreds of dollars in that bottle, and they're targeting these medications and then selling them to the teenager down the street, creating an overdose. And that bottle with your name on it is found in their dead hand. So it's more serious than you might think about a little pilfer out of a medicine cabinet. It leads to big problems.
So the responsible thing is to drop them off at these convenient locations and get rid of it the way it should be getting rid of. Thanks so much, Ole. Dr. Snyder, nice to have you here. Thanks for the advice. And again, it's Saturday, and we'll put that information on KUSI.com for you. Thanks so much for being with us, Doctor.